When caring for a patient with burns, one of the first questions is, does this patient need a specialized burn center or the intensive care unit? A simple way to remember burn center referral is the word special. S stands for size. Burns involving more than 10% of the total body surface area, especially partial or full thickness burns, require specialized burn care because they can lead to major fluid loss, shock, and infection. P stands for problem areas. Burns involving the face, hands, feet, genitalia, or major joints require referral because they can affect breathing, function, and long term mobility. E stands for electrical or chemical burns. These injuries often extend much deeper than what you can see on the skin and may damage muscles, nerves, blood vessels, or internal organs. C stands for circumferential burns. Burns that wrap completely around an arm, leg, chest, or neck can restrict blood flow or prevent the chest from expanding during breathing. These patients may require an emergency escharotomy. I stands for inhalation injury. If a patient was trapped in a fire, has facial burns, singed nasal hairs, soot around the mouth, hoarseness, or difficulty breathing, always suspect airway injury. Airway swelling can worsen rapidly, so early intubation may be life saving. A stands for associated trauma or serious medical conditions. Burn patients with fractures, head injuries, heart disease, kidney disease, or other major illnesses have a much higher risk of complications. L stands for little or elderly patients. Young children and older adults have less physiologic reserve and are more likely to develop serious complications after burns. When does a burn patient need the ICU? Not every burn patient requires intensive care, but ICU admission is necessary when the patient becomes hemodynamically unstable or develops life threatening complications. A burn patient belongs in the ICU if they have burns involving more than 10 to 25% total body surface area in adults or significant burns in children or older adults. Inhalation injury requiring oxygen therapy or mechanical ventilation. Burn shock with hypotension, tachycardia, decreased urine output, or the need for aggressive fluid resuscitation. Respiratory failure requiring intubation or ventilator support. Severe electrical burns with cardiac arrhythmias or muscle damage. Circumferential burns causing impaired circulation or difficulty breathing. Major burns requiring continuous monitoring, emergency surgery, or repeated wound care. Multi organ dysfunction, severe infection, or sepsis.